Morning. We are going to learn osteochondritis today. What is osteochondritis? Osteochondritis is basically disruption of blood supply to the epiphyseal part, which is occurs in growing age, which is adolescent or younger children. What will happen? Due to the disruption of the blood supply, there will be ischemia. And since there is ischemia, there is no nutrition, and compression and fragmentation and separation will occur. The bone. What are the cause of osteochondritis? Mainly, that is trauma and repetitive stress. Trauma and repetitive stress, which will decrease the vascularity and osteonecrosis will occur. Okay. There are two types of osteochondritis, mainly two types. One is push and second is pull. Push is crushing injury and pull is traction injury. What are the example of crushing injuries? And what are the example of crushing type of osteochondritis? That is Kohler's disease, Kienblock disease, Panner disease, and so many others. But we are going to learn only 2 or 3, and we'll rule out others if the question is asked. The traction type of osteochondritis, we will learn 3 names. One is Osgood-Schlatter disease, Seward disease, Johnson-Larson syndrome. I'm going to show the important X-ray later. Okay. First, we will learn about the theory. Osteochondritis dissection. Most common cause of loose body and knee joint. What will happen? It is the terminal stage of osteochondritis. What will happen? Softening and separation of osteochondral fragment will occur. Most common joint in which this osteochondritis dissection occur is knee joint. Remember, this one is very important MCQ. Which test is done to assess the osteochondritis? The Wilson test. What will we do? We'll ask the patient to internal rotation and extension of knee. If there is pain present, then the disrupted part will be pressing. So pain will be there, that is Wilson positive. Remember the name only. Okay, what is the investigation of choice for this osteochondritis? That is MRI. We'll also do X-ray, in which we'll use the spatial view, which is named as tunnel view. What will we do? We'll put a block between under the knee joint, and we'll flex the knee 45 degrees. And we'll pass the X-ray 90 degree. Okay. What will be the management of this osteochondritis? Early osteochondritis we will manage conservatively, that is immobilization based, etc. Pain relief by NSAIDs. Okay. The late is OATS, osteochondral autologous transplantation system. Okay. Now I'll see the X-rays of osteochondritis, which are important X-ray only. Okay. The sliding Larsen-Johnson syndrome. Lower part of patella will be affected. Osgood-Schroeder tibial tuberosity will be affected. This one is cohort disease. Navicular bone osteochondritis. Okay, Keene block disease. Lunate will be affected in Keene block disease. Okay, this is Savers disease. Calcaneal part will be affected. Okay, this is Osgood-Schroeder disease. Again, tibial tuberosity will be affected. So these are the included on X-ray: Osgood-Schroeder, Shaver, lunate, navicular, that is Kohler, sliding Larsen-Johnson, which is lower part of patella. Thank you very much.